Since we've joined ReFocus, we've had a lot of benefits added to our practice, just more support for our back office staff, whether it's billing, whether it's supplies, keeping the office staffed with what we need. Those things have been very helpful. Also, they've been really helpful with marketing endeavors and giving us more resources for those activities and helping us facilitate things such as lectures or CME talks for our local optometrists or other doctors, where we give lectures and up to date on various aspects of healthcare and how we can share best practices amongst other practices. These have all been helpful additions since ReFocus has joined us.
One of the challenges in ophthalmology is keeping up the latest technology, and from an economic standpoint, we have very pricey toys. We're very, very different than many other specialties in that even just in the office setting, the equipment is really expensive and quality equipment is the most expensive. So any new equipment that we need to have the organization invest in, there needs to be a need for it. The docs, this typically will begin with the docs, as it should be, in terms of determining whether CT needs to be upgraded or whether a visual field machine. And I will say in the 5 years that I was there, I did not see any pushback in terms of us needing to go with a newer piece of equipment. They're very much like, in a sense, computer-related items in that there does need to be an upgrade at a certain point in time. Whether the technology changes significantly or whether it's similar technology, but it's just something which is more accurate and which is more spot on, well, accuracy is obviously a tremendous need in terms of any kind of diagnostics that we're doing. So yes, there's an absolute commitment to making sure that the offices are offering state-of-the-art care, but also with state-of-the-art equipment. If you're still running your own practice and if you're in that kind of environment, that becomes your lease, that becomes your burden, that becomes your people to make sure that this new piece of equipment is going to be compatible with any number of other kinds of electronic integration in the office. A lot of the logistics that we've discussed regarding HIPAA issues and various kinds of reporting mandates and dealing with the third-party payers and so forth. So that was really nice. I've had a terrific practice administrator who's still with us, by the way, Suzanne Grazioli. And Suzanne was still dealing with a lot of the things occurring in the office. So I would be involved with things of that nature. But in some ways I wanted to because they were people issues. But certainly from the standpoint of many other logistical nightmares and so forth, it was just something which I was being relieved of. The one thing that I did want to have involvement in, and I continue to do that and I'm still doing it, is the recruiting of the young docs. If you do want to increase your premium lens practice, if you want to increase your conversion rate, there are some things you need to be willing to discuss with the patient one-on-one. You've got to mention cost. You have to do that.
The ability for physicians to be autonomous, to do what they do best historically, that has not changed whatsoever. And that's exactly why we did this deal with a company like ReFocus. They have not macro-managed. They've helped out with some of the HR parts of running a practice and some of the mundane parts that otherwise we did not enjoy. Some of us did, some of us did not. So it's been relatively seamless and it's gone well. And now we're into year 2 and we're hoping to get stronger and better together as we continue to feel each other out and what we want to do aspirationally to help other practices grow and to help other practices that are outside of our platform join our platform. Because guess what? You have the ability to be stronger together as a group. And we truly, truly believe that.